Hello, everyone. Welcome to yet another Girls in Gis Real Talk edition. This week we will be, or this episode, we will be tackling women's health. This is something that I'm sure a lot of you have questions about. We'll be covering all sorts of topics, anything from periods, hormones, menopause, and of course, pregnancy. So we have on some experts here that will be sharing their knowledge with us. First up, we have Michele Syska. Thanks for being on today.
Thank
We have
you.
Edna Becht on with us as well. And we
Hi.
have Erika Fore. So we are super excited to dive into this. I'm sure this is something that a lot of our viewers today have questions on, and we hope to cover as many questions as you guys have and answer all things women's reproductive health. So, first off, this is a question I get a lot when it comes to women in jujitsu, asking, do you train while you're in your period? How do you manage your PMS and menstrual symptoms for when you train? Anything from like breast sensitivity, heavy flows, etc. So, where what advice do you guys have for these women that are training and do have any range? It's a spectrum, right, of how we're impacted by PMS and menstrual symptoms. So what advice would you ladies have out for these women that all of us that are impacted by it?
I can speak to that. The first thing I would talk about, because I hear this or I see this in the Women's Grappling Network a lot, every week it seems like there's someone asking, what do I do? Cups, period panties, tampons, like what should I use? I am a sexuality educator. I talk a lot about periods and different products we can use. I want to address first, there's this like overarching pressure, it seems, for people who bleed to be eco-friendly and never use tampons, never use pads. It's bad for the planet. And I just want to say before anything else, it's really okay if other stuff doesn't work for you. Like if cups don't work for you because they don't work for everyone, it's okay. You're not murdering like the sea turtles every time you use a tampon. It's really okay to use whatever works for you. As far as cups go, I think the first place I would direct someone to is a website called putacupinit.com.
Yeah,
they do
great.
reviews of like you're familiar. They do tons of reviews of different cups, so you can really see like comparing different cups to other cups. That's like the best resource I found. For cups specifically, I'm also a big fan of menstrual discs, which aren't nearly as popular as cups, but they are. They look like a disc or like a diaphragm. If you've ever seen something like that, those are very helpful as well, especially for people who have, a cervix or uterus that isn't positioned directly in the center of the vaginal canal, which is a lot of people. And I'm also a huge fan of Think's period panties. They just work like nothing else I've experienced. I have used those. I've worn those for like 3 hours of rolling and then like 2 hours of acro yoga afterwards. And even with a really heavy flow, you're not going to get leakage. You're not going to get like, smell issues that people worry about when people's faces are between your legs in jiu-jitsu. So I'm a big fan of mixing and matching and finding what works well for you, what's going to make you feel the most comfortable on the mat, and just use those things. So I'm a big fan of like, a cup or a tampon or a disc plus period panties if you're going to be rolling. Like I find that makes me feel really comfortable, is just to kind of multi-layer so that if there is, your cup or tampon leaks, you do have a backup. So that was the first thing I wanted to say, is like, use what works for you, and like, it's okay. You're not the reason why we have, widespread pollution.
There's some really interesting research coming out about. I think people might remember the women's soccer team when they won the Olympics. They were tracking their periods and looking at the way those hormones affected their training and their ability to get strong and fast and endurance and things like that. And so when you're on your period, this is the most male physiology that you're going to experience because the estrogen, the progesterone are low. That's why you're bleeding. And so it's really a great time to, push yourself for strength and endurance and things like that. So I see that a lot on Women's Grappling Network too. Can I train on my period? Absolutely, you can. Are you comfortable training on your period? I can't help with that, but yeah, absolutely you can. And then, yeah, exactly. Finding something that works for you. I was a gymnast before I went through judo and jujitsu. And so finding whatever works for what you're wearing and the activities you're doing is important.
Yeah, absolutely. I refer people to Put a Cup in It all the time, and Put a Cup in It Thinks I love, and actually Thinks has an offshoot called Speaks that works with my females who are leaking for urinary leakage during training. That's a big thing that I work with, and they have an awesome line for that too, in addition. So that's good.
Yeah, I kind of
That's
live in those
awesome.
since I'm pregnant right now. So
Yeah.
And I think there's, I know Thinks are the brand I use a lot, but there are so many other brands that are coming out. Thinks can be a little cost prohibitive for some people. The average pair is like $50. Sometimes they do have sales, which I recommend if you don't want to spend a whole bunch of money on them. But, Nix is another brand, KNIX. They have ones that are a little less expensive. So there's the technology is not new anymore. So you can do some digging and find a lot of different brands that are kind of on a spectrum of cost if you're a little bit nervous about spending, $50+ dollars. I do also want to say there is this thing with period panties where after you've worn them for several cycles, people ask about I see online all the time, people are talking about oh, they've got kind of a smell. They smell a little funky. What do I do about that? And I think, a lot of people are uncomfortable because they think it's gross, but it's normal. I always recommend you have to soak them. It says so in the instructions, but some people just kind of throw them in the washer like any other underwear. It's really important to soak them in cold water before you wash them. And I'll use Rock and Green a lot. I'll just put some of that in with a sink full of cold water, soak them all, and then I can put them right in the washer and it works great. So just a tip for anyone who's a little bit nervous about people who've been using period underwear for a while might notice that sometimes the washing isn't always as effective if you just throw them in with your regular clothes.
This is a lot of super helpful information that you guys are offering. I'm sure, again, it's
Really
like an ongoing question that we see over and over in the jiu-jitsu community. Excellent. So you touched on it a little bit, that there's a lot more research out there now when it comes to female athletes and your cycle. Now, I haven't read that particularly, but is there a connection between having irregular periods and exercise? And is that a good or is that a bad thing?
Um, so you should be having a period, whatever is normal for you, and normal ranges from, and keep in mind that this whole thing was pioneered by men, so the the normal ranges from 21 to 35 days, but certainly there are totally healthy ladies who may have cycles that are shorter or longer than that as well. So whatever's normal for you should continue to be normal. It's kind of our proxy for knowing, are you getting enough calories? Are you getting enough nutrition? And so there's something very dangerous. It's gone by a lot of names, but I think right now they're calling it the female athletic triad, where ladies train so hard or calorie restrict with their training to the point where they stop having periods. And we know that they lose bone density. We know that they're not building muscle mass, and they can't sustain those workouts. They can't be their best competitive selves that way. So whatever's normal for you, you should be having your period. Now, some ladies have abnormal periods, and I think we don't talk about that enough either. Um, PCOS or polycystic ovarian syndrome, endometriosis and adenomyosis and things like that. There's not a lot well known about it. And so your provider may not be real knowledgeable about it. And even a knowledgeable provider is going to tell you there's a lot we don't know about it. And so knowing what's normal, what's abnormal, when to see a provider and so forth is also really important.
So our cycle is kind of like a window into our health, kind of to way to maintain are we overtraining, maybe into the dangerous phase where we're risking further health issues. Um, but did anybody else want to add anything into that as well? No? Okay. So, what are, maybe this is kind of touching on the same thing, but is there a connection between how heavy your flow is and your hormones? Is there any sort of direct connection between those two?
There can be. What happens is, especially if you have one of those longer cycles, if you're having a lot of estrogen and progesterone spike, you're going to build up that uterine lining and it's going to feel heavier. But a lot of it comes from fibroids. Those are benign growths in the uterus. Those cause painful periods, heavy periods. The uterus can't really squeeze, contract, get all that blood out and be done with it. And so yeah, those can be pretty nasty sometimes. Ovarian cysts also can kind of change what your cycle looks like, and so yeah, there are a lot of things. Again, know what's normal for your body, and then kind of know what's abnormal as well. Talk to your provider if you think if it's could be abnormal.
Gotcha. So, and it's a growing demographic in jujitsu. We're seeing a lot of women coming into jujitsu now in their late 30s, going into their 40s, even to their 50s now. Um, what advice do you have for women that are starting menopause or are going through it, and how that, and managing the symptoms of that as far as how it relates to being an athlete or jujitsu in jujitsu?
So yeah, again, the research we have is really on a lot of endurance athletes. So a lot of our triathletes, the women's soccer team, there's not a whole lot on grappling. I would say with perimenopause and menopause, with the drop off of those female hormones, we do see bone density changes. And so talking to your provider, do I need a bone density test? Obviously, jujitsu is just so good for your cardiovascular health, your resistance training, bone density and things like that. So it's a wonderful thing, but you also want to see what your risk factor is, for those sorts of things as you go through menopause. But that's about all I can speak to intelligently with those hormone changes.
Hmm.
I would like to add one thing to that, and that is, regardless of where you are life cycle wise, whether you're facing menopause or you're far, ahead of that or beyond that, I think it's really important as women that we understand that the medical field, especially when it comes to gynecology, there's a lot of bias in that field. There's a lot of racism in the field as well, especially in gynecology. There's a lot of fat phobia and people with larger bodies facing a lot of unfair bias, and that can really derail the medical care that you get or compromise the medical care that you get. So I always like to advise people that when you are going to the doctor, just remind yourself that like you have to be your own advocate or bring someone to advocate with you if you need that kind of support. Your provider doesn't know everything all the time, and sometimes they're just wrong. I've had a lot of reproductive health issues throughout my life, and I've talked to a lot of doctors, and I've heard just some really wild, horrible things from doctors. Like there's just a lot of bias. So just know, if you go in, if you think something is wrong, assert that. If something doesn't
Absolutely.
feel right in your body, don't just take it. If a provider tells you that's not really a problem, you don't need a bone density scan. If you want one or you need one, push for that. Your doctor works for you, and they should be partnering with you if they are a good provider. And I do just also want to throw in there are a lot of women, especially, who have experienced sexual violence, and as a result are really uncomfortable going to a doctor or a provider where they're going to have a physical exam, where they're going to be partially nude in front of a stranger. Please know you can also go to a midwife if you need an exam or something basic. Please know that there are providers like midwives who aren't necessarily in a doctor's office, and the environment is a little bit more, it's a little softer, it's a little less sterile, so it can be a little more comfortable. But again, just want to throw out there, please know that you deserve good medical care. You don't deserve abuse from a provider ever. You don't deserve bias, racism, sexism from your provider ever. So if you are working with a provider who is making you uncomfortable or not answering your questions or just giving you bad advice, seek another one or advocate for yourself or ask a loved one to come in and help you advocate for yourself.
I love that. I love that so much. That's what I try to tell my women. Even if you're listening and you hear just something that resonates with you, that you're like, okay, you got validation that, okay, what I'm feeling, there's something, just to push for that, just to, you definitely, you deserve to be heard. You do not tolerate it's all in your head. Do not tolerate you're a certain age and this is supposed to happen, or, don't accept that. As far as menopause goes, and there's a site that I refer people to, because there are some physicians who've taken an extra step to take the extra training to treat people with menopause and have that extra learning, because it is such an art. It is such an additional thing that they can add to their practice if they, to really put forth that care, that extra care and that extra knowledge. And it's just menopause.com. And you can search for your area and find a physician or a healthcare provider in your area who has taken that extra training step.
Yeah. No, I think
And
that's so
as a
important.
physician, I would completely agree with that. I mean, we
Mhm.
are people, and we do have strengths and interests, and some people are not interested in the
Absolutely.
postmenopausal female, and some people are
Mhm.
not interested in my period still hurt, and
Mhm.
that's not a right fit if that's what you're there for. So we're just people too, and you got to find the right fit for you.
Mhm. For
Exactly.
me in particular, with menopause, with hormonal changes, premenopause, I see a lot of, I come across a lot of vaginal changes and a lot of changes within the pelvic floor, continence issues, and painful sex starts to emerge. And these are real things, and they deserve attention. And there's so many things out there now that can help bring comfort, and you shouldn't have to live like that.
And that's my line to a lot of ladies is this is common, but it's not exactly normal. And so
Yeah,
we
you don't have to
shouldn't,
deal with it.
yeah, we shouldn't just say, oh, well, you're 50 now, so that's how it is. It's
Hmm.
common, but it doesn't have to be the way things are.
Absolutely.
That's awesome.
And I would also like to add, it can be tempting if you don't get the right answer, a good answer, supportive answer from a physician or provider to, go into like the click hole of the internet and try to find, just know that can be really helpful to hear what is working for other people, to hear other people's stories. Just know it can also be really helpful to take a lot of those and maybe go back to another provider to kind of verify some of that, because not all of it is sound, and everyone's got their own experiences that are very helpful, and sometimes they cannot be helpful. So I think it's good to balance having a good provider you can trust, and also like asking for opinions, advice, experience from other people. If your period hurts and your doctor just says, I don't know, there's nothing we can do. It can be helpful to go and find out what other people who are living with period pain are doing, and then work with a provider to trial and error. And a good provider should encourage experimentation and trial and error with tools and
Hmm.
resources that are available in 2021.
I'd like to add to it that endometriosis is such a spinoff from that. And it's just excessive pain. And so many women go misdiagnosed, or, because it does take a laparoscopy to diagnose that truly. And so, I have referred people to a Facebook group called Nancy's Nook. It's incredibly well run, and it's a great resource for women. There's also a podcast called The Cycle, and it's very well run by somebody I know personally. And it is extremely important to find somebody who does, like Edna said, it's their specialty, it's their thing, it's their passion. And you really need to get in with a specialist in the area, and that is passionate about treating endometriosis, because it can be very mistreated.
And it takes a while to diagnose it. It's often what we call a diagnosis of exclusion, which is my least favorite way of practicing medicine. I've got to
Absolutely.
rule out X, Y, and Z before we get
I
to
know.
endometriosis, adenomyosis,
Absolutely.
sorts of things. And frankly, that's not something I will ever diagnose because I'm not a surgeon.
Hmm.
That's like you said, it takes a laparoscopy and everything else. So,
Hmm.
yeah, it is. I tell people it's like peeling an onion sometimes. So we're going to find
Hmm.
out what three things it's not today, bring you back, see how
Hmm.
our interventions have changed things, and go from there.
I have 3 young women right now on my schedule for my in-clinic care, and they came to me, all 3 of them came to me with they couldn't get a tampon in, and they're young. And nobody, actually one of them, she's 18 and she's already had 3 surgeries for endometriosis, and she needs a third, and I'm trying to encourage her in a different direction. And she's had everything under the sun. She's only 18, and it just breaks my heart. And so she can't. So these women are either in the dark. Why all of a sudden I can't get a tampon, and what is happening? And so it's interesting to me how understood the whole field of endometriosis is.
Well, and again, knowing what's normal is very important, and we don't talk
Hmm.
about that. Like,
Yep.
I can't put in a tampon. Really, that's weird.
Hmm.
If everything is healthy, that should be something that's accommodated.
Right.
And so, finding out what's abnormal, so we know when to seek care,
Hmm.
is equally as important as knowing what's normal for your body, because there's a
Yep.
lot of variation person to person.
Absolutely.
And that's where I think I've actually had very little experience with doctors actually talking about vaginismus, which is a very legit thing.
Hmm.
If you can't get a tampon in, that should be a legitimate, option to consider. And especially, which one of you does pelvic floor health?
It's me.
Michele?
Yeah.
Yeah. And it's just amazing that it's not as discussed in doctors' offices. I hear it talked a lot about among pelvic health experts, but it's so common. And I think so many women have so much shame and like discomfort and trauma around it that they don't want to be poked and prodded further. They don't really know
Hmm.
what to talk about. If their doctor doesn't bring it up or discuss it with them, they don't know where to go. So Michele, could you talk a little bit about that and like what can someone expect when they go to a pelvic PT? I think that's a really important thing to hear.
Yeah. So for pelvic PT, basically what you're going to get and what you should get is somebody to sit in front of you and ask you your entire gamut history, like everything from childhood on and anything you've experienced, and we value that subjective history, just getting all of the information we can and putting together the pieces for you, knowing that we might not always come to the actual answer, but we will start putting together a plan of care based on that. And you want somebody to sit down and listen to everything you have to say. And for a lot of women that come see us, it's the first time any provider has really sat down and asked them everything. How is intercourse? Are you sexually active? What are you doing for sexual activity that you would consider sexual activity? Can you participate? What's going on with your bladder, your bowel system? Not a lot of providers sit and talk about all those things with their patients. So we get all that information. And then from there, we do an objective. So we get measurements. So what we look at, we do kind of a basic lumbosacral evaluation, like any physical therapist would do to you if you went to see them for your back. So we look at spinal involvement, nerve, muscle, soft tissue, how you're moving, joint integrity. We ask you might be coming to me with some incontinence, but I'm going to go through and ask you about any traumas that you've had. And trauma for me might be totally different than trauma for somebody else. And so I like to blanket statement the word trauma because it can be defined very differently from person to person. So and then for the pelvic floor itself, it's not like an absolute that we have to do an internal evaluation, but we are trained in doing internal evaluations. We don't use speculums like your gynecologist would use. We just basically go in, glove up, we have one finger, and we go in and we kind of test muscle tissue, check for nerves, check functionality of the muscles, make sure that they are contracting, relaxing, and bulging, and check where the organs are placed in relation to the muscles. And when you push, what happens? When you cough, what happens? Get you standing. So it's very based on that subjective, that history you give us, and that guides all of the measures that we take. If somebody is leaking with a certain move, I'm going to get them in that certain move and I'm going to see what's happening. Or if they're feeling like their bladder's falling out of their body when they go up and down stairs, well, I'm going to get a step in the office and I'm going to see what's happening, step up on that step. But with that said, knowing that when someone comes in with pelvic floor issues, I am not throwing everything at them. It's very much building rapport, building trust, and letting the patient guide the entire process that follows after the history is taken. So if I sense that someone's coming in and they're like, I want the answers today. Okay, let's do this. Let's get on the table and So getting to know what the comfort level is and slowly building into those things that are a little bit more uncomfortable. If there is, for instance, my 18-year-old, she has not been examined internally by a gynecologist and she has not been sexually active. So for her, it's going to be maybe even not an issue that I will not even approach internal therapy with her, and I'll be approaching her externally and doing all I can for that. And that, I feel like that's an important piece that we have to consider. And so it's not an absolute, but it is within our clinical skill set to do that.
That's
I've
awesome.
heard that, high impact sports can also impact the pelvic floor. Would jujitsu be considered one of them? And what are your thoughts on that?
Absolutely. So with high impact, jujitsu isn't necessarily the high impact, but it's high pressure. So we have this whole canister system that with our diaphragm, our pelvic floor, stomach muscles, back muscles, this is all encompassing of your core, and regulation of pressures within that system are heavily dependent on how those muscle structures are functioning. So if we have one of those systems not functioning properly, like your pelvic floor, if there's weakness, if there's restrictions, for whatever reason, surgery, trauma, whatever that I might be treating somebody for, then there's a I like to call it the weaker player on the team. So like the whole team of the core, we have a player that's not quite caught up to the rest of them. So if you have pressures coming into that system, like a knee on belly, or you're pulling in close for a choke, or like anytime we're compressing through that midsection and that canister gets compressed, if something is not playing along well with the rest of the team, like the pelvic floor, then you will experience your prolapsing, your leaking, maybe some just instabilities, not feeling quite strong enough, or like you just can't quite give all you can for some of those quick maneuvering positions. So yeah, I also like to refer, think of like a tube of toothpaste with the cap off. So if you have that tube, the cap's off, and you're squeezing, then things are going to fall out if you don't have that cap doing its job. So yeah, so in relation to jujitsu, it's very much pressure sensitivity and trying to get our bodies to cooperate better with that pressure and manage it better.
That's so cool.
So, so are there, like, as a general, I'm sure it's specific for each person, each situation, what is kind of the general, are there exercises that you recommend, treatments, therapy to kind of help strengthen that? And I'm sure, like I said, it's probably dependent upon each situation, correct?
Yeah, it's very general. It's something I've been challenged to work on with the women in my group, because they, just slowly over time have been like, hey, how do I do this? What do I do? I want to work with you, that kind of thing. So it depends on the person. Okay, I've talked to several of the women in the group, and some of them are just, they really cannot keep consistent and disciplined with something. So I've created a one-on-one program where they can work with me one-on-one. I do movement assessment, full evaluation, take them through an 8-week process of very custom exercises for them, and meet with them once a week. So that would be one person. Another person might do well with just education on some deep core, and how the pelvic floor plays with the core, and how important that is in our sport, and how the hips play into that. And so just education on, I do a lot of that, a lot of just free education in my group, all about exercises and related to, like just yesterday, I did a video on how we can incorporate core and the right muscle groups to do mount escapes and side control escapes. So trying to do it really jujitsu very specific, but also help them to dig into the core, help that leakage issue. And so I have a core program with that too. And it's amazing. Like these athletic women, we all so strong, but once you really start digging into this deep core that we have, it is so powerful. And once you really be consistent with something and set a goal, and just understand what it feels like to contract those muscles, and let them go and relax them, and bring them in with the entire core system, or maybe not even so much. A lot of the athletes that I treat, I would say 99% of the athletes that I treat, I'm helping them understand how to relax those muscles before contracting anything, because we are so, and we're taught, keep that stomach tight, contract that pelvic floor, and go, go, go. But sometimes it just gets so hypertonic and hyper holding that in itself can cause leakage and prolapse issues. So I would say I'm teaching diaphragmatic breathing, relaxation, pelvic floor awareness, get a sense of what it feels like. And that typically, if anybody out there is listening and wants to just practice some breathing and letting go first, and then try your jumping jacks, try your high knees, try your drilling tech, your running with relaxing that pelvic floor, and don't even think about contracting it. And you probably will see a difference.
So cool. I'm so fascinated by pelvic floor stuff because I didn't even know until I've been in a lot of PT for like injuries and stuff. And I didn't know until maybe like 2 years ago that pelvic floor PT was even a thing. And I think there's this common opinion that like pelvic floor PT is for if you've had a baby. And it was just a couple weeks ago, I'm working with a dietitian for some like other health stuff. And she was saying that even like, you know, if you're chronically constipated, that could be related to your pelvic floor. And I was like, what? Like, I had no idea. I just think it's so interesting because it's a topic or I guess a field that isn't quite as mainstream yet as it probably should be. Cause I just hear that it's just incredible for so many people.
Yeah, so much can impact it. That you mentioned constipation. I would say, I mean, again, probably 99% of my patients, I am asking, what's going on with your bowel system? Are you constipated? Are you, you know, like constipation is not necessarily not going for 3 or 4 days. You can be constipated going every day, but it's just not clearing. And your pelvic floor will respond negatively to that and tense. And it's going to be very difficult to relax. And then you're going to have added leakage, added prolapse, pressure, just physiologically that bowel system coming into the bladder, causing more urgency, frequency, leakage, and all that, you know, just more pressure. So more inability to manage the pressures when you have a knee coming in your belly, if those muscles are holding tight and they're just, you know, that's a form of dysfunction in those muscles when they can't relax.
So Edna, are there any other approaches that as a physician, they kind of recommend, you know, somebody comes to you and they have issues that, you know, would fall under pelvic floor? Do you recommend like outsourcing to a pelvic floor like therapist? Is that like the standard if somebody comes to you and they have symptoms that could be a result of that? I'm just curious.
Yeah, so if I think that the issue is a pelvic floor issue, not a hormonal issue, you know, there are degrees of prolapse that are just going to take surgery. Then absolutely, physical therapy is my number one go-to. It's like Michelle said, it's so comprehensive. You know, I can't think of any adverse effects, Michelle, of doing physical therapy.
Yeah, that's it. I mean,
You
like,
know,
just send them to me. They're not going to hurt them. It's, you know, just walking in and learning about your body, you can 70% improve by
right.
just learning. Yeah.
And you know, for me to say, oh, let's just throw hormones at you is I hate it. I have an inherited clotting disorder, and so hormones for me cause blood clots, not exactly the healthiest thing. And so there's a lot of reasons, you know, especially as we get near menopause, perimenopause, you know, cancer risks and blood clots and strokes and heart attacks, you know, the all of those risk factors. Yes, I would much prefer to go to a pelvic floor physical therapist and see if we can't fix the problem rather than trying to mask symptoms. So,
Yeah,
you
but
know,
on
again,
the same side of that, we value you and what you can bring for the hormonal health, because sometimes we have just an inflamed pelvic floor, vaginal canal, the tissues are inflamed, and we need something to help calm that down so we can then go ahead and help them with that muscular. And then I know you'll probably agree. I think a lot of people need to know that if you have the vaginal dryness and leakage and it's a hormonal issue, we need topical, we need like local. So going into a physician and taking an oral medication isn't going to affect vaginal dryness and leakage issues when it comes to estrogen. So I just wanted to put that out there.
topical, so much safer, so much more effective. I 100% agree. And so, yes, absolutely. There are things, you know, the vaginitis that I should be taking care of. You know, you kind of touched on it. Are there sacral nerve issues? Are there pinched nerve issues that I need to be looking at, or a neurosurgeon needs to be looking at more closely? So, yeah, that's kind of my purview, is to make sure that there's nothing that needs a surgeon. You know, we can try if I think there's a fix for it, you know, medically speaking, I'll try that. But no, physical therapy is just amazing.
Yeah. Do you fit pessaries? Do you ever work with
I
that?
don't. I was never
Okay.
trained on it. I've got a couple
Yeah.
partners who do.
Yeah, I think people, they need to go to somebody who's definitely trained in it. I find that urogynecology tends to be somebody who can fit very well for pessaries. That's typically who I'll send people to. I just was curious if you did.
So for anybody who doesn't know, a pessary is a little, usually a disc sort of silicone plastic thing that fits into the vaginal canal to help with prolapse, incontinence, making sure that those structures stay where they're supposed to. If the
Hmm.
pelvic floor or is I don't want to say stretched out, but that kind of thing. It just kind of helps physically prop things up where they're supposed to be.
Hmm.
Wow, this is so informative. All right, let's talk babies. So it's a question I get over and over again. Can I train while I'm pregnant? And I'm sure, again, there's a spectrum, right? Depends on if you're a high risk pregnancy, et cetera, et cetera. So, what are your thoughts on can you train while you're pregnant? And if not, what kind of supplemental movement or training do you guys recommend?
So I'm 25 weeks pregnant. This is my second pregnancy. I trained up until the week I delivered with my first. And so it can be done. I do want to caution people that pregnancy in and of itself is a high risk scenario. 1 in 4 fertilized eggs will not result in a happy, healthy baby. So you're already starting at maybe a 75% achievement rate. And depending on certain things, where that baby implants, where your placenta is, do you have more than one baby? What is your cervix doing? Do you have a history of incompetent cervix, preterm labor? I've got an inherited blood clotting disorder. I've got to be on blood thinners while I'm pregnant, and so that affects my risk of bleeding and bruising, with pressure and those sorts of activities. So, knowing what your risk factors are going into it is one thing. My general reaction when every time I see this on Facebook, which is becoming, I think, like once a week or something, which is awesome, is no takedowns. We definitely do not advise pregnant ladies to fall. Um, no contact sports is kind of the blanket statement. So I would argue that if you're not doing takedowns, if you're not doing striking, grappling is not a force contact sport. You'd be at a higher risk of getting hit by a volleyball or a basketball
Hmm.
uh, than controlled grappling. And so that is one thing I recommend to people: no takedowns, no knee on belly. It's just uncomfortable, ladies. And for the first 12 weeks, that baby is well within the pelvis. Short of getting stabbed in the pelvis, you are not going to hurt that baby. After 12
Hmm.
weeks, though, it is out of the pelvis, and you do have to be careful how much pressure or force you're putting onto your baby, and potentially, again, that placenta. That placenta comes off, we are all hosed. So, want to make sure that you keep that safe. Um, and then just from personal experience, everybody's different, but breast tenderness, I will tap to any sort of chest pressure right now. It's just not happening. So finding out what your comfort zone is there as well is important. But no, I think it can be done safely. I don't roll live. I have a trusted partner. My husband happens to be a brown belt, and so he's kind of my guide that I get to drill with, maybe flow roll with. I'll flow roll with some of the brown and black belts, but I usually don't take on any whites at this point. I'm usually not rolling live at this point.
Hmm. Yeah, I agree with that completely. Just taking tissue integrity into consideration as well, because as the belly grows, 100% of pregnant women will have a thinning of that abdominal wall. So, and then as well the pelvic floor too. So, runners and heavy weightlifters or CrossFitters, we do ask that they kind of back off, not to stop, but be mindful of the heaviness and the pressure through the pelvic floor that they're putting, because it can set you up for issues after. But that being said, I mean, I agree. I agree with you 100%. Grappling is just something you, like you said, you just want to make good decisions with it. Make sure you are with partners that you trust, because, don't have the new white belt come at you. Absolutely. Train with higher belt levels. Um, just be safe with it. Make smart decisions. Absolutely. No takedowns. I 100% agree with that too.
Yeah, no, that could be bad.
Yeah.
And let them know what you're comfortable with too. You know, we
Mhm.
were doing a King of the Hill when I was pregnant with my first, and my rule was just no knee on belly. We're just doing King of the Hill, guys. You know, you don't actually need to win this crown. And he's actually another, was it a blue belt or a purple belt? He was almost a purple if he wasn't a purple. And the first thing he did was went knee on belly, and I was like, tap him out.
Oh,
You know, like he didn't hurt me or anything, but I wasn't going to give him that opportunity either. Tap early,
Mhm.
tap often. Nobody wants to be the one who causes a pregnant lady to bleed, chokes a pregnant lady out, or breaks a
Mhm.
pregnant lady's arm.
oh
Yeah. Yeah.
gosh.
Yeah.
Be a good partner.
Yeah. Yeah. I think that's
Well,
common sense.
I think the other thing too is just to put the message out there. If you are somebody who is higher risk, jujitsu is going to be there for you when it's all said and done, right? We
Hmm.
don't have to be superwoman. We are superwomen because you're creating a human inside of you. So you're doing this amazing thing, and if you're continuing it for you and to stay active and healthy, awesome. But if you're doing it to keep up with the rest, or be the woman who can just keep going and do it all, it's just not necessary. And I just like to put that message out there too, because, and the same thing for getting back to it after, remembering that at 6 weeks, when our physicians are saying go ahead and do whatever, our tissues are only 50% tensile strength that they were previous to pregnancy. So your tissue pliability and your tissue integrity is not ready to handle that full on everything, no holds barred. And it's okay to let yourself, get back to that slowly.
Yeah, that was going to
And
be my
I'll just,
next question.
I was just going to add that I think it's really important to underline what these two just said when it comes to, like, if you're in the early parts of pregnancy and you're sick a lot or you're exhausted, like, it doesn't make you a lesser athlete because you can't
Absolutely.
train right now. It doesn't make, like, as someone, like, I tore my ACL last year and had to have it reconstructed. I was benched for quite a while from that. I know it sucks to not be able to train, for your body to just not allow you to right now. But it doesn't help that, yes, of course, the mats will always be there. That doesn't help when you're feeling down on yourself because you can't train the way everyone else can. But, I just wanted to really say that because I hear that from so many pregnant women. Like, I see these athletes who are training like crazy throughout their whole pregnancy, and it's so inspiring, and I want to be like that. But, like, everyone is different. And if you're too exhausted or you've been vomiting for weeks straight, like, let your body rest. Like, you need to do that. Like, you owe yourself that.
And that
Each
comparison game is so dangerous because you don't know what those athletes are or should be doing at that moment.
Exactly. And I would say the same to postpartum as well. There are so many people who are so focused on getting back to the mats or getting their body back. And, like, I really wish we could just destroy that mentality
Get rid of it.
altogether.
Get rid
Because
of it. Yeah.
there are some athletes, especially female grapplers, who were right back on the mats like a week after the baby was born. And that's fantastic for them. But like to your point, you don't know what their situation was. You don't know what they were doing with their doctor. Like, that's not I don't want to say that's not normal, but it's not the norm. It's not what most people
it doesn't
can
have to
get
be the
back into.
expectation.
Exactly. Yes.
That's great.
Yes. It doesn't have to be the expectation. It doesn't make you lesser if, your body still looks wildly different for a long time or even forever after you have a baby. That is the most common situation. So I just wanted to say that to people who are, giving birth soon or have just given birth. Like, it's great that there are so many athletes who bounce back or whatever. I mean, but that's not, I just wish that wasn't the focus for so many people because it causes so much unnecessary strife. Like,
Yeah.
you're raising a baby, like, it's a lot, and things are going to change, and that should be okay. But I know that it doesn't always feel okay. So again, just kind of to adjust the mindset around comparison as it relates to getting back on the mat really fast or having the energy or having the strength or whatever that looks like for someone.
Mhm.
And I would even caution that each pregnancy looks different and your
Yeah.
expectations have to be different. I
Mhm.
felt like superwoman when I was pregnant with my first. Like I said, I was able to train. I was in the gym a couple times a week doing elliptical, lifting. I really felt amazing, and I have felt like boo this entire pregnancy. I'm 25 weeks today, and so that looks really different for me. I'm much more uncomfortable on the mats this time around than I was last time. And so that looks very different for me. And so it's hard for me to say, well, this is different this time around. So I'm not going to be able to achieve what I did last time. And that's okay because I'm still growing a human, which is pretty dang cool.
Yeah.
Um, so yeah, and I guess a couple other things, just from in general, OB, being active is awesome in pregnancy.
Mhm.
If you're able to continue, even if it's walking, prenatal yoga, if it's swimming, some form of movement, it helps build a healthy baby that tends to do better during the labor process. It's hard. Labor is hard on babies. Labor is hard on mamas. It helps mamas, potentially shorten that pushing the labor process.
Mhm.
Maybe your body is a little bit more adaptive and a little bit more responsive to that, and the postpartum as well. So we know that ladies who and again, when I say active, I don't mean that you are training for a competition. I mean just walking is fine, but we do see that the postpartum tends to be a little bit easier on them as well. So activity is wonderful, but that can look different from what you're used to. It can look different from pregnancy to pregnancy, woman to woman, that sort of thing.
Mhm.
What about, say, for women who have undergone like a hysterectomy? Is there anything that you guys can offer as far as advice in coming back after having a hysterectomy? How does that look? Is that something that you guys work with at all?
I mean,
Um,
that's going to be more, physicians saying, okay, you can get back usually at 6 to 8 weeks. Scar tissue healing has to take place. That's a little different because your tissues aren't going through the changes like they do for a pregnancy. And of course, I'm sure you both would agree that it depends on the reason for the hysterectomy,
yes.
what's going on there. So,
Yeah, it depends on how the hysterectomy is done.
mhm.
If it's a vaginal hysterectomy, a hysterectomy, an abdominal hysterectomy, the healing time is going to be different there. It depends on why it's being done. If it's for a gigantic fibroid, then you may want to do some of that pelvic floor rehab just to kind of figure out what your new normal is without that big bulky uterus in there, and that sort of thing. So yeah, it depends on a lot of things, but you definitely want to give those tissues. And same thing if you have a C-section delivery, you want to
Mhm.
make sure that your muscles, your fascia,
Mhm.
all of that stuff has a chance to really get knit back together, really be quite strong before you start, as Michelle said, squeezing that tube of toothpaste.
Mhm. Yeah, and another
Well,
thing with hysterectomy, there's going to be a difference in prognosis of support system for the bladder when you leave the cervix as opposed to when you have the cervix taken. So there will be a distinction in this, just the general support system that the cervix provides will give you more support for the bladder. When that's gone, your chances of that bladder falling are higher. And I do recommend getting in and seeing a pelvic floor PT just because you want to see where you're at so that you can give that pelvic floor the education, the understanding that it needs to play with the core properly so that you're not, press and pressure, so that
Mhm.
you're utilizing your body properly during just even having bowel movements. So you know how to mechanically work that better, which I totally recommend the squatty potty. Everybody should have one.
Oh, it's
Those are
amazing.
awesome.
Like hands down.
It's amazing.
but also I think it's important because I have heard this said so many times, like when your doctor says you can get back to normal activity, just remember what we do is not what most people do. Like grappling is not normal activity. So like, I think it's important to make sure that your doctor is aware of not just I train jujitsu, but what do these movements look like? If your doctor does not train jujitsu, is not familiar with it, like emphasizing like it could involve pressure on these parts of my body. It can involve this kind of pushing, this kind of pulling, like really help them understand that if
Mhm.
if they're not already familiar, because so many people take that go back to normal activity timeline and run with it because they just want to get back on the mats, not knowing that like normal activity for most people is like maybe going on a light jog or like, like going for a swim, picking up your kid, and that's not what we do all the time. Like that's not grappling.
Yeah, absolutely. Well, I'm going to go ahead and close out with any kind of final thoughts or advice that you may have in relations to women's health. If you have anything you want to add on to, women managing severe menstrual symptoms, having severe pelvic floor issues, maybe having a rough pregnancy, anything that you guys can offer as kind of a final thought.
I would like to add that, and I'm not like sponsored by this company or anything, I just have found that as someone who has had extremely painful periods for most of my life and tried like everything over the counter, all kind of alternative therapies, nothing worked. One product I found extremely helpful is a line called Foria, Foria. They do CBD and THC products. So they do like oils and lubricants and all kinds of things, but specifically when it comes to managing menstrual pain, they make suppositories that are inserted vaginally. You can buy the CBD only ones if you don't do THC or you can't do THC for some job related reason. The CBD suppositories are, I think they're just made with like cocoa butter, and it's super like natural and like, not a lot of like other fillers and stuff. You can put those in and then put a tampon in, and those are extremely helpful for period pain, like in a way that I've never seen anything else work. So I found that the ones that have THC in them are slightly more effective, and it's, despite what you might think, it doesn't actually cause a psychoactive effect because it's inserted vaginally. But the CBD only can be bought in stores like sex toy stores sometimes carry them. You can buy them on their website because it's CBD is not a controlled substance. If you want the THC version, you will have to go to a place that sells that. We're in Colorado, so that's not hard to find. But if you're not, just kind of look around and see what you can find. But the CBD only ones are fantastic, and I highly recommend those for period pain.
That's cool. I'm going to look that up.
They're really cool. Yeah, they are. I will say though, be prepared. You do need to put a tampon in behind them because it's cocoa butter. It's going to melt inside of your body and it's going to be a gross mess.
Okay.
So you've got to put something in behind it to keep it in, but it really does help for training, especially.
But
for me, I guess.
I was going to say, just in some states, CBD is considered THC. I live in one of those states. And so just know what the legality is. I don't think anybody's busting anybody for vaginal CBD, but just be aware of that too.
Yeah, absolutely. Yeah. I guess closing thoughts for me, for anyone out there who's questioning pelvic floor issues, whether it's prolapse issues, post-pregnancy, urinary leakage, fecal incontinence, I am here for you. Reach out. I have been training jujitsu. I have been doing pelvic floor PT for 18 years. And I have a Facebook group called Women in Jiu-Jitsu where I give a lot of free information and education just to help bring knowledge and just to go into your healthcare providers with better information and ask better questions. And you can always private message me on Facebook. You can come in and learn about how to work with me one-on-one. And I have a core program that I just ran for the first time a month ago. I'm going to be running another one in April because it went well. So if you're interested in that, just message me and we can talk.
Excellent.
And then I think we should do, if there's anybody young out there who's thinking, what should I do with my life? I really like grappling. Get into research because there's a lot more to be known about normal female physiology, normal menstruating physiology, and specifically when it comes to grapplers. Like I said, a lot of the stuff that's been done is for endurance athletes. It's not for the grapplers. And so you can kind of extrapolate, like I said, training on your period can be a really great thing because you've got kind of that male physiology going on. And then you can kind of change. It sounds like you might have a dietitian on. You might ask the dietitian about changing your intake to match your cycle as you go through. But for me, track your cycles, know what's normal for you. know what's normal for a cycle too, so that you know when to contact your provider, whether that is a midwife, as Erika said, whether that's a nurse practitioner, a PA, a physician, whoever that is, that fits with you. Um, and just be aware that there are seasons in a female life. So what you're doing when you're 20, what you're doing when you're 30, what you're doing postpartum and postmenopausal is going to look a little bit different, but hopefully you can stay on the mats and stay healthy.
Mhm.
Excellent. Oh, this is so informative. I'm so happy that we did have this discussion today.
Me too. Thank you so much for inviting all of us.
Absolutely, yes.
Oh, absolutely. Thank you for being a
It's
part
fun.
of it. I think that, I walked away with some more knowledge myself, and I hope that our viewers here today, we can answer some of those questions, and maybe we won't see as many posts of the same nature in these quizzes. But it's good to have this information out there because there isn't anything. This
Mhm.
is a discussion that's not been had by experts of yourself in varying different fields, but similar as well. So thank you so much for sharing your knowledge with us. Thank you for being on today. Thank you everybody for tuning in. And tune in next time. We'll be discussing more women's health in regards to optimal performance, nutrition, and recovery. So that'll be next month. So thank you all for being on, and take care, everybody.
Bye. Thank you.
Thank you. Bye.